Today, we're going to be talking about the mental health impacts after an STI diagnosis in high school students. So, objectives. We have identify and understand risk factors, and this is to analyze the correlation between substance use and mental health, focusing on how heavy alcohol and marijuana use serves as a mediator for mental health issues in adolescents. The objective is also to evaluate the specific risk factors that affect boys regarding mental health and substance use, particularly in relation to depression symptoms following a diagnosis. Secondly, it's also to highlight screening recommendations, and this is to advocate for the implementation of mental health screenings for sexually active teens to help detect and address mental health issues early. It's also to emphasize the importance of monitoring mental health in teens who have received a diagnosis and understanding the necessity of ongoing support. Also is to investigate the unique challenges faced by teens, which is to explore the reasons why teens are at higher risk of sexuality, or sexually transmitted infections due to factors such as child abuse, trauma, poverty, and mental health disorders. It's also to identify how involvement in delinquency and substance-related offenses affects mental health outcomes among youth. It's also to address issues post-diagnosis, and this is to discuss the emotional challenges that teens face after receiving a diagnosis, including feelings of shame and isolation, and how these can lead to a decline in mental health. And it's also to evaluate the availability of services for teenagers and the emotional toll these challenges can create. Is also to propose effective solutions like actionable strategies for supporting teens, including the establishment of school-based support programs and the importance of mental health screenings post-diagnosis. And to develop collaboration frameworks with nurses and counselors along with training staff on trauma-informed care. Lastly, to emphasize the importance of emotional resilience, which is to explain how implementing peer support groups and promoting conversations around STIs can help normalize these discussions among teens. And to underline the impact of these measures on reducing the risk of depression, encouraging early treatment, and fostering emotional resilience among teenagers. All right, so I have found that more than a, or this slide, more than a diagnosis, mental health impacts. So I found that the National Longitudinal Study of Adolescents Health by Dr. Carl Miller has shown that after 1 year of diagnosis of a STI in teens, they have struggled with high levels of depression. This includes using substance abuse as a mediator like marijuana and alcohol. And studies have also shown that boys who drink alcohol are more often and more likely to be diagnosed with the STI due to the increase in risky behavior. Some recommendations for teenagers that have been diagnosed is mental health screenings for sexually active teens. And it's very important to monitor teens who have been diagnosed. Why focus on teens? Teens who have issues of trauma like child abuse, poverty, mental health disorders are more likely to be treated for an STI. Interestingly enough, youth involved in delinquency or substance-related offenses are less likely to receive STI treatment despite being at risk. Instead, teens who do receive care are more identified through mental health or child protective services, not through justice or substance abuse systems. This shows that healthcare providers treating teens with STIs should explore the possible role of mental health and trauma histories so teens who struggle mentally can have more access to mental health care systems to get treatment earlier to prevent them from participating in risky behaviors leading to potential STI. So the missing piece in STI care. The issue identified where many teens experience shame, isolation, and mental health decline after an STI diagnosis. Traditional health services don't address the emotional toll because they normally don't try to offer mental health care and sexual health care services after a diagnosis. This is why we should have more solutions like school-based support programs, including counseling, peer support, STI education without stigma, mental health screenings should be offered after an STI diagnosis as well. So helping teens heal the right way is very important. And I think we should implement this by partnering with school nurses and counselors with local health clinics, train staff in trauma-informed and inclusive care, and confidential peer support groups or mental health check-ins and post-diagnosis. Why this matters? This matters because we want to reduce the risk of long-term depression or self-harm for teenagers that are diagnosed, and it encourages early treatment and healthier sexual behaviors, normalizes STI conversation and reduces shame for people who are diagnosed, and it fosters emotional resilience during a very vulnerable time. As shown in this graph, it shows the social determinants, discrimination, segregation, healthcare access. It also shows the individual attributes, personal health status, beliefs, and attitudes about sex, and the epidemiologic context, epidemiologic context, STI/HIV prevalence, the population level sex practices, which is very important, individual behaviors. In conclusion, individual behaviors, sex practices, treatment, adherence. So in conclusion, my thoughts are that it's important to help these teens heal in the right way. So that way they can receive the help that they need so they don't end up in a long-term depression. All right, and lastly, here are my references. Thank you so much for listening to my presentation, and have a good evening.